Hey y'all, I'm Ashley,
And I'm Damo.
and welcome to the Black Nurses POV. Let's get it.
Boo, 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 boo. Ashley, what is up, man?
Girl, just another day in paradise.
Oh, paradise, huh? Girl, I'm on like the last day of my period.
Mm.
And it's just been like a crazy roller coaster. Like at this point, I'm just like, look, send a text message because I can't.
Right, because I just end mine too. So it's like, at what point can we just? Because it's getting worse. I'm older now. Well, I'm 35 now.
Girl.
So this last time, these cramps and all this stuff was way.
It's not the same.
It's
I
not
don't
the
remember
same.
feeling my period like when I was younger. Like once I hit 30, it was, what is this? What is this nausea? What are
Mm-hmm.
these period codes? What is this? Why am I having a hot flash? Like,
Mm.
what's going
No,
on?
for real, because I didn't have PMS. Like, as far as like mood swings and all that stuff. Now I literally be watching the stupidest thing, like a commercial or something, and I'll be in here boo-hoo crying now. But back in the day, it wasn't like that.
In a minute and a half.
And like literally like tearing up. I'm like, and I'm laughing afterwards, like, what am I crying? I was like, my period must be coming. It has to be, because ain't no way I'm crying over this.
I'm a real G. I do not cry
No, I forgot
over
what it was.
commercials.
I forgot what it was. It was really stupid. I think it was like a pet saving commercial. I don't know. It was like, this is just so beautiful. Just start crying.
In the eyes
Right.
of an angel.
Right.
But yeah, it's like those symptoms are ridiculous. And I can't even imagine like the people who like bleed all the time, like having to go through a pad or two every hour.
Yeah.
Like I couldn't imagine getting through all my day. It's just the cramps in general for me. Like the tire, your fatigue,
The
like you
fatigue.
don't have no energy.
The fatigue is no joke. Because I know for sure, like, I got to sleep. Like, I really just feel it coming. And then I'll have a headache for like 3 days before it starts. So I don't know what that's about, because that's new too.
For me, I'll get like a really bad hot flash the day before it starts, like literally out of nowhere, drenching in sweat, and I just know like, okay, tomorrow I'm about to be
Dang. Like, it's really
Michael
private
Myers.
summer. Like, private summer.
Yes, and I'm like, please, Lord, don't let that be my menopause symptom, because I can't
think
do
so.
it. It's too hot.
I'll never forget the time I was shopping with my mom one time, and she we're talking, and I turned around, I turned back around, and she was just drenched in sweat, like not even a full minute. I'm like, you having a hot flash? And she said, yes. I was like, dang, that's cold. Like, I couldn't imagine. I'm happy I don't have that symptom, at least.
Oh my God, girl. These hormones are crazy. And to know like you're experiencing a hormonal shift like 3 weeks out of the month.
Yes.
So we don't even really get like a day to be chill.
No. It's like literally your period ends. You got a couple days to recover from that. Then you're ovulating. Then your body getting ready for the next, like literally every week it's something that your body is transitioning to. So sorry guys if we have mood swings. I mean,
yeah, it's definitely nature for sure.
it's not our fault.
It's not our fault.
Blame Eve. My cousin told me, she's like, I'm sorry, y'all. My cousin's like, I want to catch hands with Eve as soon as I get to heaven. Because why? Why I gotta go?
Why you have to eat the apple?
Right. You couldn't just not leave the apple alone.
My thing is, Adam, come on, sir. Why you ate the apple too?
Oh, yeah.
You could have saved humanity.
Right. Well,
Yeah.
Adam and Eve, we coming for y'all. I'm sorry.
We got questions.
we got
need
questions.
To know
right.
what y'all was doing.
But I noticed too, because I don't know if I told you, but I had fibroids when I got them like 29. And we'll give you guys a history of what are fibroids and all that stuff. But that's when I started having like the heavier periods. I now didn't have all the symptoms of like what I'm having now, but the heavier periods. And that, it was bad. Like, it was really, really bad.
And when you had what's a heavy period?
At one point I was in class, and sorry guys, I had a Supermax tampon and a Supermax pad, and I had to change both every hour on the hour. And if not, I was on leak everywhere.
Oh my God.
So it was heavy. And I had to do that even when I was asleep. You know what I'm saying? Like, at least in sleep, I'm kind of trying to be still, but still, like, you can't be comfortable like that.
Right.
So it was extremely heavy. And luckily, mine were small. They're like the tip of my finger, but
Mm.
where they were
Mhm.
caused all the bleeding.
Right. And then just like the social aspect of it. You're at
Yeah,
school,
I'm at
like
school.
worried about whether or not you're going to
Yeah,
bleed out. And
right.
then the possibility that that can happen at the grocery store or anywhere. And you're
And
like grown.
yeah,
Yeah.
I couldn't do nothing. I remember I told one of my good friends, he's a guy. He's like, I remember that day because I was like, dang, what's wrong with Ashley? She keep going to the restroom. I'm like, dude, I had to, or it was gonna be literally bloody murder. Like I
Everywhere.
couldn't do that at school. And luckily we have blue scrubs on, so you really couldn't see, but still.
And that's thank God because they used to have to wear white
White
scrubs.
scrubs.
Like, why would y'all make us wear
I
white scrubs
know.
to see everything?
White scrubs always. They try to bring them back, I heard.
Why? You
'Cause
want me to
they'll
see all the germs that's on me?
but they try to say that's how you know your scrubs are clean because you gotta bleach them.
I'm,
But I hate white scrubs, period. But then I guess it's just like I don't know. People wear scrubs like the next day. I don't know.
I mean,
don't.
I do know some people who do.
Okay.
And I have on occasion,
Mm-hmm.
depending like if I'm going from home health to
Oh yeah, that's
wherever, you know what I
different.
mean?
That's different.
But still, at the end of the day, you gotta wash them. Like you're not bleaching all of your scrubs.
Yeah, but
like
they
the
want to
colored
wear.
ones.
They saying if you wear white, you gotta bleach them.
So like even the nurses that's working.
Yeah.
So what happens if I get poop on mine? Can I go home?
Girl, you know you ain't
They
letting us
gonna
go
have
home.
extra scrubs?
No, you know that's not gonna happen. You have to just scrub it off with a bleach wipe and keep it pushing.
Bye. Shout out to Santa Claus though. I'll take a bath in that sometimes.
I do. I'm a person who wipe my hands with it. I'm like, I know I ain't supposed to do this, but
Right.
it makes me feel so clean when I do it.
I know. It's like I will risk the cancer.
Yeah,
at this
exactly.
Point
That's
because...
fine because I don't want to bring these other germs in the hospital home. It's too much.
I mean, that is interesting though when it comes to the scrubs because I believe in like other countries they don't allow you to wear your scrubs outside.
That makes sense though.
Yeah, because people go eat lunch at Starbucks and it's like where you just come from,
right?
And what you got on you,
right?
So
because I know even with my shoes, when I get in the car, spray them down with Lysol.
Yeah, I have my flip flops in there.
Yeah,
or my slides, and I'll change out of them.
You have to because you don't want to bring that stuff on.
I can't imagine like during COVID, like people who had just had babies and kids, and how you figure out where to take off your decontaminate, take off your stuff. You know what I mean? Like
you have to have I know some people that build like outside showers.
And some people who didn't even go home. Like
that's kind of heavy, bro. With that type of stuff.
That's crazy. That's crazy for real.
Yeah. But let's say back to the fibroid situation. Do you want to talk about what they are?
Yeah, so basically a fibroid is like a collection of tissue and muscle that can be found in any layer of the uterus. So depending on where they are, how big they are, you may end up experiencing heavy bleeding, intense cramping, frequent urination because it may be pressing on the bladder. Some people have like abdominal distension or like a large abdomen that looks like they're pregnant. They are considered benign growths, which are non-cancerous. Usually during your childbearing years, you have the highest risk of formation just because your uterus is constantly shedding its lining, so things are constantly growing and repairing.
And African American women are more at risk for fibroids than others.
Yeah, they said about a quarter of African American women between the ages of 18 and 40 have fibroids, and that's significantly higher than our non-Black counterparts.
And it's like really no exact cause of it. It just happens. Because I know mine's my mom had it, and so with her having it, I end up having it, and then I think birth control increases your chances. High blood pressure, say obesity.
Yeah, PCOS, any kind of hormonal issues that you may have. In African American women, not only are we just more prone to scarring in general, so you have the keloid formation, you have fibroids, which is considered a scarring process. We have the scarring alopecia, the CCCA. So we are more prone to having those kind of scarring issues.
Yeah. I think I know multiple women that have the symptoms but haven't been diagnosed because they said about 70% of women do have them, but I only knew TMI because I was going to get a IUD.
Mm,
Because at first I didn't know. I just thought I had a heavy period. So
mhm.
when I was looking at the IUD and they did the ultrasound and they found, they was like, oh no, it's not a clear path. Like you have fibroids, and that's how I found out.
Mm,
So I did end up getting a procedure done to get them removed. But with fibroids, they don't necessarily, they could grow back.
mhm.
So right now I'm in the clear, but I still have to get regularly pap smears, more than regular, like probably once a year, just to make sure that they're not growing back, and if they do, handle it before it gets too bad to where they were.
Yeah, it's a hormonal component to it. So they find that in menopause, they start to shrink on their own because you have less hormones circulating. And then also with metformin, it's
Mm.
actually metformin. I love metformin not only as an anti-diabetic drug, but we're finding that it helps to reduce scarring and to
Wow.
prevent the formation of fibroids, as well
Oh,
as help with scarring alopecia. So
wow. I did not know that.
yeah, it's been studies starting to coming out and circulating now that
Hmm.
shows that there's some improvement with the use of metformin for those things. So there's options out there. Like you said, a lot of people don't know they will deal with like heavy periods
Hmm.
and things like that because we think it's normal.
Hmm.
But it's definitely something that you should um, let your doctor know so then they can like further investigate just to make sure there's nothing that can
Wow.
see what can be done.
So I have a question because, okay, I have fibroids, then I have this, I know people that have cysts.
Sorry.
Is it a, sorry, is it a big difference between the cysts
Fibroids
and
and cysts.
cysts? Yeah.
Um,
Because can cysts
Basically,
rupture?
it's cysts can rupture. It's
Okay.
basically what it's made up of.
Okay.
So, like with the fibroids, it's more of thicker kind of tissue, so you don't necessarily have to worry about that rupturing. Whereas
Mhm.
a cyst is kind of filled with like fluid and things like that that it can
Oh,
rupture. Hmm.
okay. But are so PCOS is what?
So that's polycystic ovarian syndrome.
Mhm.
So basically, like your ovaries produce a whole lot of follicles, and it kind of almost like a popcorn formation over the ovary.
Wow.
Yeah. So you can have that along with polycystic kidney disease, where you have the same kind of cluster
Mhm.
of cyst around.
Mhm.
So that can lead to abdominal pain,
Mhm.
heavy periods.
Mhm.
It could lead to infertility or trouble getting pregnant.
Yeah, because I know that, and then they have a lot of more. Well, is it all kind of like the four hormone imbalances too, or?
There's always a hormonal component just because that's how our bodies are wired. Now, sometimes it could be too much estrogen or too little estrogen, too much
Mhm.
progesterone, too little progesterone. So that's why it's very important to talk with your doctor, have your blood work done just to see which hormones may be causing it,
Okay.
and how yeah, they can help.
Okay. Just because I know all these people, a lot of people with different diseases, and I didn't know. I mean, some things I'm more familiar with, but like
Mhm.
PCOS, you hear about it, but you really don't investigate like that unless you know you have it yourself, or
Mhm.
and you don't see it often. Where I work, I don't see it often like that.
Yeah, I think for some of us, a lot of it is subclinical as well. So you'll have people, you'll have excessive facial hair,
Yeah, exactly. I
have
seen it.
trouble losing weight, that kind of thing. So you may have some form of PCOS, but it may not show in your blood work.
Mm.
So those are kind of the harder cases because it's like I can't prove that you
Mhm.
have it.
Mhm.
So technically, I'm just treating based on what my
The
idea of
symptoms.
it is.
Yeah.
Yeah. Um, but I think a lot of people actually deal with it, like Kiki Palmer, she was talking about
Yeah.
her journey with it, and I think for a long time, her lab work was normal, and
Mhm.
she was just trying to figure out why she had bad acne, why,
Mhm.
these things were happening for her, and, trickle down to it that it's
PCOS.
PCOS, yeah.
Congrats to her too on her baby.
I know,
I'm
congrats,
happy. I know. I'm
Kiki.
happy that she was able to have one with the PCOS because I know that is probably one of the things that is not a bad thing, but a
And
symptom.
probably drove her decision to, like, go ahead and have kids now.
Yeah, exactly. Because I
Mhm.
just got if she's
Yeah,
already young, might as well
yeah, best chances.
right get it
Mhm,
done now.
mhm,
So, because I know also too, I was reading that a lot of people have fibroids and don't even know it, and
mhm.
and still get pregnant. Because I know that's when I found out I had that's what was one of my fears. Like, oh shoot, I won't be able to get pregnant because I have fibroids, but that's not necessarily true.
Yeah, no, it's just that the fibroids take up space, so
Mhm.
you have to be mindful when you do get pregnant. But depending on the size of the fibroid and again where they're located, that will determine what type of symptoms you have. But it doesn't necessarily interfere with you getting pregnant. Um, outside of just taking up the space to where it's not enough room for the baby to like
Yeah.
grow.
Okay.
Mhm.
And then is it like, cause okay, like I said, only reason how I got diagnosed was the ultrasound, and I know if even if I do a Pap smear, is that really gonna check for that, or I'm still have to go get ultrasounds because.
If they're big enough on Pap smear when they do like the manual exam,
Mhm.
where they use their hands to kind of feel over your ovaries and
Yeah.
your uterus, then they can feel it. But usually they're smaller than that, so ultrasound is like the mainstay
Okay. Yeah.
of
Cause
testing to diagnose.
yeah. Cause
Mhm.
I got. Oof, I had to get the regular ultrasound, and then they did the trans went inside the vagina and checked too.
Yeah.
That was so uncomfortable. It was so uncomfortable,
Yeah,
but
if you think the speculum is uncomfortable,
I
that
know, yeah. Like you think
ultrasound,
that the Pap smear, the ultrasound is totally different because it's really, they have to move around and check, and it's like, what am I right now?
yeah, it's an experience. It looks
It's
like a vibrator, and it's just like,
yes, it's not
what?
that, and it's not
What are we setting up for
not
here?
as that, but they definitely have to do all that for me to get properly diagnosed, and I'm grateful that I got the surgery because that was really bad.
Hmm.
It was really just
So your periods were better after.
I didn't have a period for a whole year after.
Really? That is
For a
interesting.
whole year after. I was like, "Okay,
Right, like, did
God,
y'all do it right?
hold up.
What's
Do I
going
still got something
on?
down there? Because hold up, this is not right." But
I did not ask for
yeah, I didn't ask for.
hysterectomy.
Yeah,
I
I
asked
need
for
my ovary still, but I didn't have a period for a whole year, and then it came back. Now it's regular.
mm,
Now just the symptoms are getting worse, but
mhm.
I don't know if that's just because of the age or just
I mean, you do have some risk of it growing back too, so it could be a
ugh.
mix of both of them.
That's what I'm scared of.
Yeah.
Ain't nothing you could do to not get it.
Yeah. I mean, you can slow the progress of them, but kinda once it starts, it's a process.
That's a lot.
Mhm.
And to think Black women are the main ones.
And then even between that age group, you know what I mean? Between 18 and 40, those are young, you
Yeah, you
know?
still young.
You still
You could get
considering whether or
pregnant.
want,
Uh-huh.
you want kids or
Mhm.
whatnot, and to
Mhm.
have to make that decision so early on. And then to think of later on having to have the surgery again or having to go through treatment options
Right.
again,
Right.
is something to definitely consider and think about,
Right.
and stuff that we don't talk about or think about.
Right. Because
Yeah.
I haven't really. If I, it's just hard. Because now I really want to have kids. I'm like 35. I'm ready to start a family. I'm ready to do all this stuff. And it's like, okay, so if I do have them, then what? Like, or what if it's blocking again? So
Hmm.
do I have to get it done to make sure that I'm able to have it, naturally?
Yeah, usually they will recommend that you have them removed or shrunk prior to getting pregnant just
Mhm.
to increase your chances.
Mhm.
But again, it doesn't necessarily interfere with the chances. That's where
Okay.
you got to collaborate with your doctor just to make sure, get the imaging done, know where you are, and then go from there.
What do you mean shrink? Is it like a
So they have a procedure where they can go in and they can cut off the blood supply to
mm,
that fibroid, and so over time it'll shrink. And
mhm.
then again, menopausal women, they don't necessarily have the estrogen floating around that are feeding the fibroids, so
Okay.
they start to shrink on their own too.
Okay.
Hmm.
Okay. Yeah, girl. It's a lot. I'm getting
Hmm.
old.
Right.
Getting old out here.
Right. Like fertility issues, having to think about
You
that.
have to think about all that stuff
Even
now.
young,
Yeah.
and we don't know where it's coming from. It could be the food that we're eating.
I think it's a food.
I know there's been a correlation between like Johnson and Johnson powder and baby products, and
Yeah.
now it's like mainstay in our community,
That's for
like
sure. Baby powder everywhere.
under the arms, under the
Yeah,
breast, between the
everything
legs,
everywhere. Now it's like, okay, if you had this, you might have cancer.
in
What?
all those areas.
Yeah.
So it's on the rise in Black women, and we tend to get the most aggressive forms of those cancers.
Mm.
So it's something to look at when it comes to relaxers, because we use those frequently in our
Yep.
hair
Mhm.
from young.
Yeah, no, from
We were putting baby powders in the baby's diaper to
yes,
keep them,
you dry
to
and
help with the
clean.
moisture.
Uh-huh.
So, um, yeah, it's a little bit scary to think about.
Cause
Like,
it's like everything is. I think it's a food too, just because of
mm-hmm,
the how they put the hormones in the food. So and we're consuming it all the time. So why
mm-hmm,
would we not have these imbalances or all these different things going on because of that? Cause
and showing up earlier too.
yeah, cause
Hmm.
these kids is way bigger than what we was.
And going through way more things than we did,
Yeah.
like PCOS,
Yes.
fibroids, things like that,
Kids
ovarian cysts.
at young, like before high school.
Hmm.
Like at this point, you shouldn't.
Diabetes, high blood pressure, like
Diabetes
it's
for
crazy
sure.
at this point.
Diabetes for sure, and high blood pressure. And I've never seen that. When we was kids, everybody was just you just out there doing whatever. But
Yeah, even the overweight ones, it was just like managed diet,
yeah,
exercise. You didn't
exactly.
really hear about kids having to be on medication,
Mm-hmm.
and really seeing doctors for these things
Right.
the way that they are now.
'Cause
And
even-
it's alarming considering where we are healthcare wise in the country or
right.
compared to
Other
developing
countries.
nations. Like
Mm-hmm.
we're the lowest on the totem pole.
Yeah, that's crazy. Because even like when I look at McDonald's, all them places, like, and now like I know my mom when they were younger, they talked about this. Like she's like McDonald's was a treat. Like that was a treat. We didn't feel like cooking. You had it like once a week. But
Mhm.
now you see now people eat that stuff daily
Mhm.
or at least a few times a week. And especially with kids, it's like, and you see how big these chicken wings are now.
Like, is that a chicken wing? What chicken did
Right,
you get that
chicken.
from?
What chicken did you get that from? Because how does chicken, this wing, this that big? Anything big like that,
I
I'm
can't.
suspicious. I'm like, I can't even eat it because I don't even know for sure if it's saying what it's supposed to say. Supposed to be.
For real. And now that they have like, I was reading an article. I guess they have like this good meat type chicken where they make the chicken in the lab. It's literally like down to
No.
the atomic level, similar to chicken. Like basically the same thing is just made in a lab, so they can make chicken breasts instead of the whole chicken. Make chicken
So
wings.
what is it?
I don't know.
What is it?
I don't know, but do we really know what we eating now?
No, we don't. That's why I understand people that be vegan. Jesus. I'm trying to figure my life out because I can't keep eating this meat because it's not
Or whatever it is. What is it?
what is it? Because it's not supposed to be doing this. Especially like tilapia. When I found out tilapia was a farm
Like
raised, they
yeah,
made the
they
tilapia.
make it, yeah.
It's not like a wild catch fish.
Mm-hmm.
And even that one, like disparities in community, like to get fresh food or fresh just the good stuff, you got to go far out.
Mm-hmm.
Cause I was watching what was it? I forgot what I was. Oh, it was a TikTok on Instagram, and there's like look at your vegetables. They were at Walmart, and they pulled up like what the vegetables are like bell peppers.
Mm-hmm.
They pulled it up, and it was just roaches under. And I'm like, I don't have to think about that when I'm going to get my vegetables now. But you have to go home and clean your vegetables and stuff too. But to think about like to get the good quality things, you have to go far out to get it. You can't get that in the mostly Black communities.
Yeah, no, definitely, and it's a very huge disparity as far as access to fresh fruits, fresh foods, stuff like that. And they don't make it easy to grow your own at home.
No, they don't.
I know they always talk about like the slave diet and how our diet has been passed down, but our grandmothers used to be able to go out in the garden and pick their
Yes.
vegetables. So even though it wasn't necessarily the healthiest preparation of those things because it was coming from,
Right.
a more natural place, it tended to do better for them.
Right.
Then for us, it's like everything is processed.
Everything. Because I know my grandma had her own garden in Compton and still was digging and picking stuff. And I was just like, okay, yep. But now it's just
Obsolete. Like nobody
Yeah.
really
I
does
want my
that.
own.
Everybody has plants though, but they don't really have a garden to
No.
feed themselves.
I much rather when I get a house,
Mm-hmm.
I want to have my own garden.
Mm-hmm. In the backyard.
Yep.
It's a lot that goes into it though.
It's a you
like
have
the
to bring it
pests
done.
and all of that.
It's a lot, but I feel like it'll be worth it
For sure.
because either that or go to Whole Foods all the time.
Mm-hmm. I mean, you can pick different places like Aldi. I love Aldi.
Mm-hmm.
I love Grocery Outlet. They tend to have like connections with local farmers and stuff like that
I didn't know
to
that.
have fresh produce.
I didn't know that.
And cheaper, and they kind of bulk buy as
Mhm.
well. You can go to farmers markets,
I love
that
farmers
kind of
markets.
thing.
I love farmers market. A good farmers market, I'll be in there.
All the time, every time they have
I
one.
love when they have the little fresh fruit, like the ones you could try. Oh
Mhm.
my goodness. My job actually has one every Wednesday.
Mm.
A farmers market come there.
Yeah, I'm finding that a lot of hospitals are actually like investing into that, having farmers markets and healthier options for patients and visitors to have. So that's good. That's always a good thing.
Well, yeah, because I mean, at the end of the day, my motto is even though being in healthcare career, I mean, it's better to like. I'd rather buy the expensive food and healthier food now, or than pay for in medication later.
Mm-hmm.
because it's
Mhm.
kind of either or type of situation for me that I've seen. Like
Mhm.
I'd rather invest in myself now, get my body used to eating this type of way, than taking meds later. Cause
Yeah. I mean, for me, it's more of a do the best that you can with what you got.
yeah,
So
I get
may
it.
if you have to go to McDonald's for whatever reason, make it the best choice at McDonald's, that kind of thing.
But what's a good choice to McDonald's?
I mean,
I'm sorry.
if you're talking about processing,
May I don't know.
it's probably not the best, but you can stay within your calories, you can
That's
stay within
true.
your
Yeah.
macros, you can
Yeah.
stay, you're not gonna avoid processed things.
Yeah, that's true.
You just want to make the best decision, like I said, in
Well,
every chance you get.
that's true because I still Beyond Meat still is like
And I love
it's
it. It
good.
is. It's scary. It's like, why is it
Exactly.
sizzling like that?
Exactly. Like I like it, but it's like what is this still? What am I eating?
Right. Like this looks like real meat. It smells like dog
Real-
food, but
Oh, don't say dog food.
it don't taste like dog food.
No,
Though.
if
I
you
mean,
see
I don't
the
know what dog food tastes like.
but you
I can
smell, you
imagine.
can
Yeah, you can
imagine the
smell it.
smell like
If you smelled it, you tasted it.
yeah, exactly. I'm like, well,
Just letting
then,
y'all know.
well, yeah.
So
I
if you
have a
smell
dog,
what
so
if you know what poop smells like, you
Ugh.
taste it.
Oh, good God. I had the crappiest patient the other day. I just can't believe it.
Literally crappy.
Literally pooped to her ankles.
No.
I kid you not. I couldn't believe it. I just couldn't believe it. And little lady. I'm like,
Where was all of that?
where was all this in your body? Where was all this? And she just like, I went again. I'm like, oh, okay. And I was like, I'll be right back. I gotta gown up and get everything.
Right. I gotta go prepare my mind
Yes,
for this
'cause
because this is about to be a task.
I couldn't believe it. I just couldn't. I still, and I had her the next day. She's like, oh, well, it's not as bad as yesterday. I'm like, thank God, because lady, you didn't
Like,
know.
what was happening yesterday?
I don't know, but shit.
Yeah.
I was like, I told my dad about it. He was like, thought that was the funniest thing in the world. I was like, Dad, I'm not laughing at this
Like
part.
at
I
all.
was like, that was the poopiest little lady I ever had in my life. I couldn't believe. I changed socks and everything. Like, where is this?
The whole bed. Sometimes I wish they had like the shower head over the bed.
Oh, they need the shower head over the bed.
That would be so
I
much
would have hosed
better.
her off.
Real quick. Every patient would get a bath. That's so much easier.
Yeah.
Like
But people ain't trying to bathe like that.
I know it's hard. It's definitely hard to keep up with all the baths and stuff like that.
Listen, I just
Yeah.
after that day, you talking about them bleach wipes? Oh, buddy,
Whole bath and bleach and ammonia and everything.
did that and came home. My Dr. Browners scrubbing the crap out of myself. Oh my God.
Gotta clean it up. Well, that is it for today, guys.
Yes.
Thanks
Thanks
for
see you guys
coming
next
by,
time.
eavesdropping.
Yes. See you guys next time.